Welcome everyone here, especially those who have joined us in the room and trekked out here to Dallas, and those who are also joining us via web. I'm not sure that my presentation is going to be quite as exciting as what we just did, but hopefully you'll learn something and take away little tidbits. So the acronyms that are used that I'll be referring to this time are acronyms you are surely familiar with: LTCH, Long-Term Care Hospital, the data set, the LTCH CARE Data Set. Maybe not so familiar, the Social Security Number Removal Initiative, which is going to take place beginning in April of 2018, and there'll be more information about that in the following presentations. And then the spontaneous breathing trial, which is part of our new ventilator measure, that is also going to be discussed later in the presentation. The objectives today in my presentation are just to give you a summary of some of the changes, nuances, additions, and/or omissions from the CARE data set. And some of these changes by the sections, as you can see, is N. We'll have our new drug regimen review section, and that will be following my presentation with Carol Schwartz. Section A deals with administration, a few changes there. I are active diagnosis. GG, of course, our function. Section M with our skin integrity, and then Section O, which includes our ventilator liberation measure and also some of our influenza. The administration section, we have a few items that have been omitted from that. As you can see, the 2500, 2510, and 2525, which are interrupted stays. So they all will be removed in the new version 4.0 of the CARE data set. Also, which I just briefly talked about in the Social Security Number Removal Initiative, we'll be introducing the MBI, or the Medicare Beneficiary Indicator, which again will take place beginning in April 1st, 2018 through December 9th, of 2019, and more information about that will be presented later. Section B is our hearing, speech, and vision, and there's only one change to that, and that's kind of a clarification. So when we have understanding verbal, we're now adding nonverbal language to that. So BO 800, you'll see that it says verbal and now nonverbal content. So beginning section GG, probably one of the most lovely sections and loved sections that we have. We're adding a new activity to that section. So when you're coding your self-care and mobility items, we do have 07 that you're familiar with patient refused, or your 09 with not applicable. So now we're adding code 10, not attempted due to environmental limitations. And we also are keeping 88, which is not attempted due to medical conditions or safety issues. We also are removing some of these gateway questions on the admission and discharge for does the patient walk. They will be removed from that section. And also there'll be a skip pattern added for if the patient doesn't walk 10 feet, then you'll just skip on to the next section as opposed to going through. If they can't walk 10 feet, they're not going to be able to walk 50 feet at this time. So we're skipping out of that. Also in GG, we're adding some clarification for and/or. So when you're asked the question wheelchair and/or scooter, it's just more clarification on that, and/or again in the following sections, GG 017 OS1 and the following is for your wheelchair or scooter. The next section is section I, and that's your active diagnosis. And for that, we just have separated the metastatic cancer and the severe cancer. So they used to be combined in one, and now we have them broken out. We also have, with some of the heart functions, the neurological functions, and then we've listed out the various transplants that might be appropriate or coded. This slide just gives you a demonstration of how the severe and metastatic cancers have now been broken out into two separate codes. Section M, another famous section, are skin conditions or pressure ulcer. We're using the term injuries, which may be applied to the sections where it says report stage highest existing ulcers / injury. So that will be added to all of those data elements that when we asked ulcers, it'll now say / injuries to that. And that's for just better clarification. We also, and they'll be added to all the MO300 data elements. We also are removing the term suspected deep tissue injury and evolution and replacing it with a simpler term, deep tissue injury, and it would be applied to the admission and the planned discharge for MO300G and MO300G1. The last of the, well, maybe not last, but the section M still, we're adding improved clarity device, which was added non-removable dressing and device. So that, again, is for more clarity. If someone has a cast, if someone has a brace, that will be a little more applicable as opposed to just a non-removable dressing. So that's also been added to your MO300 series. Also in section M, we have removed the MO800 series, A through F, which was on your planned and discharge assessment, so all those elements and items will be removed from version 4.0 of the LTCH CARE Data Set. Section N is our new section, it's medications, and that's our drug regimen review. So as you can see, we have two data elements that are added on the admission, drug regimen review and the medication follow-up. And then on the planned discharge, unplanned discharge, and expired, we have the medication intervention, and Carol Schwartz will be going over that in more detail. Section O, special treatments, procedures, and programs. We have added the IV medications on the admission. We also have the spontaneous breathing trial, which is part of our new ventilator measure, and that will be on admission, and then the liberation rate, which will be applied to the planned and the unplanned discharge. We also have the removal of the invasive mechanical ventilator weaning and non-weaning items on the item care data set in version 4.0, sorry. Also in section O for special treatments, the influenza data elements, as we want to state, there really hasn't been any changes to that, so they'll all remain the same. Unchanged sections here are C, J, K, H, and Z. So what was on version 3.0 will also be present on the new data set 4.0. So in summary, we just have the new section, section N, which is your drug regimen review. Section A, your administrative, which are just a few changes in there, some removals and some adding. Section G, function. Section I, our active diagnosis. Section M is your skin integrity. The O is the special treatments, which includes our new measure, ventilator liberation. And that is it for me today to give a brief overview. Following, you'll have much more detail and everything I just covered. And I welcome Carol Schwartz.